Good afternoon, everyone. My name is Puspa Pokhril, and today I am going to present a short presentation on authentic leadership in nursing, the pathway to integrity and trust. In today's complex health environment, authentic leadership is one of the few models that elicit trust, openness, and ethics. In this presentation, the aim will be to dwell on how authentic leadership improves patient outcomes and also helps to cohere the nursing team together. First of all, I would like to welcome all of my student friends and my teacher, and I will guide you through the principles of authentic leadership, its key attributes, challenges, and its long-term impact on healthcare. So, beginning with the introduction, the following slide introduces the role of leadership in health settings, which is foremost assurance that teams are performing their job and patients are receiving quality care. Specifically, I will discuss authentic leadership, an approach that has a powerful focus on trust, transparency, and ethics. Authentic leaders forge strong relationships through genuine interactions and leading with integrity, which inherently instills a sense of trust in their teams. This leadership style has a significant effect on patients and teamwork because it allows open communication, collaboration, and mutual respect that are all components of high care delivery in nursing. Moving towards another slide, let's talk about the overview. This slide summarizes what we will cover in this presentation. We define clinical leadership in nursing and discuss why authenticity in healthcare leadership is important. That will be followed by an explanation of authentic leadership through a review of some core elements of their approach, self-awareness, transparency, and ethical conduct. From that base, we will see how authentic leadership engenders trust and builds on team dynamics extending to patient care. Then we will discuss the key attributes required, such as moral courage, and how those attributes inspire collaboration. The effect of authentic leadership in the real world with regard to health outcomes will be considered. Finally, we will consider some of the challenges leaders face to maintain authenticity in the high stress setting and provide suggestions for strategies that can be employed to build authentic leadership through training and mentorship. We will round it off with the future of authentic leadership in nursing. Moving towards the another slide, we will discuss about understanding clinical leadership. Clinical leadership in nursing leads the health teams towards the realization of safe, effective, and patient-centered care. According to Oxu and Hussein 2020, ethical leadership ensures that leaders make appropriate decisions while creating an atmosphere of trust and transparency, which is crucial in nursing. Nurses must work in cooperation and communicate properly about everything necessary for good expectations of outcomes. Research has documented that strong leadership is associated with improved patient outcomes and higher staff morale. The leaders who create a supportive environment ensure that their teams work in cohesion, translating into better overall care and in turn the efficiency of the healthcare system as a whole, according to Sarai et al. 2021. So, moving towards defining authentic leadership. Authentic leadership is the type of leadership whereby the central focus of the leader is to lead with integrity, basing their actions on their core values. The authentic leader fosters open communication, creates trust, and makes decisions based on ethical principles. Authentic leadership is made up of the four major components that encompasses self-awareness, which enables leaders to realize how they can reflect and influence others; transparency, where, wherein trust is built because openness takes place; ethical behavior, in which integrity ensures that it is guiding decision making; and balanced processing, where leaders look into team dynamics along with clinical outcomes. These elements are vital in nourishing and help in the establishment of an environment of trust and accountability, thus promoting ethical and effective patient care. Studies confirm that authentic leadership plays its role in healthcare, influencing team trust and patient outcomes in a positive way, according to Pune and Hilton 2020. Now we will discuss about the importance of authentic leadership in nursing. Authentic leadership is important in nursing to instill trust in nursing teams. Trust is at the heart of successful team functioning. When nursing staff trust their leaders, effective teamwork follows and quality in care provision results, according to Aliani 2022. In this respect, authentic leadership has an impact on improved patient outcomes by facilitating a culture of honesty, integrity, and openness. These leaders model ethical behavior, which means the entire team not only does the same but ensure patient-centered decisions about care are always made. Authentic leadership also shapes staff morale and job satisfaction since authentic leadership also shapes staff morale and job satisfaction. Since nurses feel more engaged and supported by their leadership, patient outcomes have shown to be markedly influenced when the staff in a very open and transparent environment feel supported. So now I would like to discuss about the key attributes of authentic leadership. Some of the main attributes of authentic leadership are self-awareness, relational transparency, and moral courage. According to Aliani 2022, self-awareness is particularly vital in that it allows the understanding of how one's behavior affects others so that one can better direct their team. Relational transparency would create a venue through which a leader may engender trust and openness among team members, both essential for any good communication and team dynamic. Also, authentic leaders show moral courage manifestly by standing up for ethical principles when this becomes very challenging to do. This is because the care of the patients must always come first, according to Kishalman and Sakshay Bhattwati 2021. The qualities inspire confidence and encourage collaboration in a supportive environment where all members feel valued and empowered to work together to provide quality care. Moving towards the next slide, now I would like to discuss about the impact of authentic leadership on healthcare. Authentic leadership has an instrumental effect on healthcare in improving morale and job satisfaction for nursing staff. Leaders who express their genuinity and transparency create an enabling environment that elicits trust and collaboration among teams. In essence, there is the possibility of improved patient outcomes since teams communicate effectively toward one goal of delivering patient-centered care. Real-life case studies have shown that authentic leadership improves the retention of staff, rounds of a team, and thereby makes the workplace much more positive for everyone and quite productive, according to Marvel 2024. Further, nursing staff working for an authentic leader usually express satisfaction with their jobs and feel empowered and valued in their jobs, which again contributes to giving better service to the patients. Now, I would like to discuss about the challenges in authentic leadership. While there are many benefits associated with authentic leadership, challenges abound, especially in the high stress health environments, according to Tahan 2019. For instance, it may be difficult for the leader to be authentic while making quick stress-induced decisions. The other challenges relates to how authenticity balances with efficiency. Hence, the need for quick decision making in emergencies might go against building relationships and trust. Meanwhile, there are also ethical dilemmas when the personal values of a later leader conflict with organizational policies or time pressure that makes living authentically difficult. Nevertheless, the challenges can be addressed by adaptive leadership strategies, emphasizing ethical training and open communication that strikes the balance between trust and decision making agility. This allows the leaders to sustain their authenticity without giving away efficiency or dislodging ethical standards, according to Gardner et al. 2021. Now, I would like to talk about how we can foster authentic leadership in nursing. Several strategies can be instituted to help foster genuine leadership among nurses. For instance, leaders should be encouraged to spend much time reflecting in themselves as a means to develop an understanding of their strengths and weaknesses so that they may lead with genuineness. Secondly, conducting workshops and ethical decision making equips the leaders with the capacity to work through complex clinical cases with compromising integrity. In addition, mentorship programs allow opportunities for seasoned leaders to mentor the individuals in the practice of authentic leadership and as such promote personal and professional growth. Finally, nursing leadership development programs promote authentic leadership by focusing on self-awareness, ethical behavior, and transparency, skills that have been proven to be essential for well-performing nursing leadership, according to Magier et al. 2022. Moving towards the next slide, now I would like to discuss on the future of authentic leadership in nursing. In the future, authentic leadership will be much more important in nursing and healthcare. Authentic leadership develops a positive effect on the team by building sustained trust that will offer more resilience in times of challenge. Its service have become increasingly complex and diverse, so the requirements for ethical decision making rise correspondingly, which increases the need for authentic leadership to assure supplies of ethical and compassionate patient care. The arising trends in leadership are pointing toward most collaborative and trust-based models with authentic leadership at the helm. This in turn will ensure that over time, developing authenticity in nursing yields sustained improvement in team cohesion, patient satisfaction, and overall healthcare outcomes while guaranteeing a brighter and more productive future for the nursing profession, according to Aliani 2022. So now I would like to discuss a short conclusion. In conclusion, authentic leadership involves trust, transparency, and collaboration in nursing teams. Authentic leadership helps create an environment of ethical decision making where patients are assured of quality care and nursing teams collaborate well for improved results. This approach also offers benefits for present times and acts as the enabler for shaping the future of nursing. It engenders trust based relationships that are essential, the elitary of complex healthcare challenges, and continue to drive superior healthcare outcomes. The way forward demands authentic leadership in maintaining strong, resilient teams with care being ethical and patient centered. Thank you for your time. So these are the references that I have been used for my presentation. Thank you. Have a good day.